Known cure for COVID-19 just yet, leading some hospitals to try experimental ways to fight the virus. Henry Ford Health System is participating in a new program they say might have saved one of their doctors. CW50's April Morton shares the story.
Since the COVID-19 crisis started, Henry Ford Hospital has treated and discharged a little over 1,700 patients. One of them, their very own Dr. Scott Kaatz. Dr. Kaatz was on his deathbed earlier this month. Doctors say a new experimental treatment may have saved his life.
We actually were able to give them blood from patients who'd recovered from COVID, presumably with antibodies, and all of them have had no complications, and all of them are actually doing well.
One of those patients doing well is Dr. Kaatz, a physician for over 30 years with Henry Ford Hospital. Staff cheered on Dr. Kaatz as he was wheeled out of Henry Ford Main Hospital, but the weeks leading up to his release were a nightmare.
Went to hell and back.
CEO of the Henry Ford Medical Group, Dr. KALKANIS, says Dr. Kaatz was the first of 14 patients given the experimental convalescent plasma treatment. Prior to receiving it, staff didn't think Dr. Kaatz would make it. On March 29th, Dr. Kaatz fell ill with COVID-19. Just a week later, he was in the ICU. A week after that, on April 12th, Dr. Kaatz was on a ventilator fighting for his life. After receiving several experimental treatments, including hydroxychloroquine, in addition to plasma, Dr. Kaatz started to improve.
It's really a big success story for us here at Henry Ford.
U.S. federal health officials have not confirmed that the plasma or any experimental treatment is effective against COVID-19. Now home and on the road to a full recovery, Dr. Kaatz received the ultimate welcome home experience. April Morton, CW50 News at 10.